So I'm now in conversation with Penny Kechagioglou, who's an oncologist at Genesis Care UK. She's taken a time off a holiday to talk to me, to tell a little bit about herself, her career, Genesis Care, before concluding with giving us a preview of what she'll be covering in the Cambridge Healthcare Training TalkSurgery Masterclasses. So Penny, just tell me a little bit about the work that you do and Genesis Care UK.
Sure. Thank you, David. I'm a consultant clinical oncologist. I work in the NHS, and for the past 2.5 years, I have been combining my clinical work in the NHS as a breast cancer specialist with being a chief medical officer for Genesis Care UK. Genesis Care UK is a global provider of diagnostic and specialist cancer services, and we have 14 diagnostic and cancer centers in the UK. And my responsibility is to create clinical strategy together with our clinical network and clinical reference groups, as well as developing the clinical governance framework and ensuring there is a culture of quality improvement within the company.
Okay, that's excellent. Could you tell me a little bit about your background and your career? How did you become involved in medicine?
Sure. I wanted to become a doctor from an early age, and seeing cancer in my family made me quite motivated to study and become a specialist oncologist, to be able to treat patients with radiotherapy and chemotherapy, as well as holistic services. And during my career, I studied for a couple of more degrees other than medicine, including public health and healthcare management, and I ended up doing an MBA. And I got fascinated by the world of business and combining business with healthcare. And it's very, very important to see the whole system, the healthcare system holistically. And that's why I was drawn into Genesis Care, where my role is more leadership and developing the physician of the future, as well as continuously improving a healthcare system. However, my passion is still oncology, and I love my clinical work, and I kept in touch with my patients by keeping up my clinical practice.
So is Genesis Care just limited to the UK, or do you provide any services internationally?
Genesis Care is a global provider of cancer services and cardiology services, and it started with one clinic in Brisbane, Australia, and expanded across the world. So we actually operate now in 4 countries, in the US, in the UK, Spain, and Australia. I am the CMO for the UK business, and I collaborate very closely with my counterparts in Spain, Australia, and USA.
That's excellent. So tell me a little bit about some of the changes that you've seen in the diagnostics and treatment of cancer in your career.
Sure. Well, we know that cancer mortality in the UK has not improved greatly compared to other countries. And what we're trying to do at Genesis Care is to constantly innovate and bring new technologies and invest in cancer to improve patient clinical outcomes. And from what I have seen, especially during the pandemic, the COVID-19 pandemic, is that a lot of patients have not presented to their GP with symptoms which may be cancer, which has led to some patients progressing with the disease during this very difficult period. And collaboration with the NHS and the private sector has been critical in maintaining essential cancer services such as oncological surgery. And by combining my private and my NHS role, I have seen that we have opened up diagnostic clinics at Genesis Care, one-stop clinics for prostate cancer, breast cancer, hematology, head and neck, so that we can provide that access to patients who may be afraid to go to an acute hospital, or they may be sitting at home anxious about whether the lump that they have found is actually cancer. And that is very important to address in the diagnostic aspect of cancer. Then is the treatment aspect, which again, surgical services have suffered, and at the NHS and at Genesis Care, we provided alternative protocol with radiotherapy, stereotactic radiotherapy, which is a very targeted radiotherapy regime that can actually cure tumors without surgery.
Okay, that's very interesting and very topical, because the newspaper today did read an article saying that the survival rates for cancer are in decline because of coronavirus, exactly for the reasons that you've outlined. And the article said that we've been put back several years in terms of the survival rate, simply because people are afraid to present themselves, and maybe the capacity of our healthcare service is not able to cope with those people that that do present. So in terms of the radiotherapy and the chemotherapy, and also the surgical options, have you seen many changes in the technology? You mentioned the targeted nature of some of your radiotherapy. How has that improved over the years?
I have seen major changes over the past few years, and especially the last year, with the development of more targeted therapies. I mentioned stereotactic radiotherapy, which is coming from an evidence-based study called the COMET study. And that has shown that even patients with metastatic cancer can survive a lot longer and with a better quality of life if we provide stereotactic radiotherapy, which is radiotherapy delivered in fewer sessions at a higher dose per session and more targeted. The technology has evolved as well, and we have responded well at Genesis Care to keep up with this. And we brought the first MR linear accelerator in the UK at our Oxford Centre. And what this wonderful machine does is that it tracks the tumour, and even if the patient moves, we can actually see that movement, and we can target and monitor the tumor movement at all time. And this is quite powerful in radiotherapy, because we know that if we don't target the tumor correctly and we hit normal tissue, patients will suffer side effects. Now, that was a long time ago. And now with those modalities, patients can live longer, they can have a better quality of life with less toxicity.
And when it comes to personalized medicine, in oncology, what's the state of play regarding the ability to be able to personalize treatments?
Again, we have seen quite a big improvement over the last 12 months. And I can speak for where I work as a Chief Medical Officer at Genesis Care UK. We have opened up special cancer hubs where patients can have an end-to-end, from diagnosis to treatment through to survivorship, a personalized pathway. What that means is that treatment is tailored according to the specific diagnosis. We use genomic tests to predict response to chemotherapy, and using the newest technologies, we can actually track how the patient is responding with radiotherapy, so we can adjust the dose accordingly. In addition, we have applied new techniques such as partial breast radiation, which means less tissue irradiation and more targeted therapy. And I think there is more to come there. And a lot of research and clinical trials are happening at the moment to actually demonstrate that a personalized pathway is much better for the patients long term.
And your relationship with the NHS, you work in the private sector. Is working with the NHS easy? Have you found that any problems with any possible conflicts between the private and public healthcare delivered through the NHS?
I enjoy working as a clinician in the NHS. It's very important to keep the patient contact and keep up to date with evidence-based medicine. In addition, the challenges are pretty similar between the NHS and the private sector. And actually, I find that both roles complement each other, and the collaboration between the NHS and the private sector has been ever most important now during the COVID-19 pandemic. And that has led to a reduced backlog on cancer treatment, because patients had had access to cancer theatres in the private sector. So actually I find that both roles that I do in the NHS and at Genesis Care, they wonderfully complement each other. And I'm able to offer both my clinical expertise and my leadership expertise.
Oh, that's wonderful. I was having a conversation with the CEO of an organization called Spirit Healthcare last week. And one of the observations that he made was that, in fact, COVID-19 has made an enormous difference to his business, because he's being able to offer services to the NHS, which has helped people to manage their personal health at home rather than having to be hospitalized. So it sounds very much from what you've been saying that the kind of work that you do now complements the NHS services in ways that may not have been quite so evident before coronavirus. Wonderful, and I do like your approach and your attitude to what you do and your passion for what you do. I'm finding more and more it's very common that people get into medicine because of their own personal experience, very often with family members, and wanting to make a personal contribution that makes a difference. So in conclusion, you are one of the speakers in the TalkSurgery Masterclasses. In fact, you are the very first speaker in the TalkSurgery Masterclasses. Could you just summarize very quickly, and maybe in 1 or 2 minutes, what exactly will delegates gain from your masterclass?
Sure. Well, before I explain about the topic that I'm going to talk about, I have to say that I'm very passionate about medical education and training. I'm an honorary clinical lecturer at Warwick University, and I teach at the graduate students, and I've postgraduate students in the past. So I'm quite passionate about transmitting that knowledge and skills that we've talked about. And the topic that I'm going to talk about this time is quality improvement. And why is it important? Well, I'm very passionate about quality improvement. I've worked with the Care Quality Commission, which we know is the healthcare regulator in the UK, on ad hoc hospital inspections. So I've been immersed with their technique and their tool of ensuring excellence in acute hospitals and private healthcare system. And I'm very passionate in transmitting that knowledge in very simple words and simple practical tools from experience, but evidence-based experience. And we know that during the COVID-19 pandemic, maybe the quality of the service in many clinics and hospitals may have dropped. And it's about how do we work together as teams to maintain that quality and go one step further, see quality improvement as a continuous innovation, and make sure that we engage our people from frontline to executives in any healthcare organization to be able to achieve that goal of quality improvement.
Well, I think that's a fantastic goal and a good insight into what you're able to deliver in the TalkSurgery Masterclasses. And once again, I'd like to thank you for giving your time to talk to me today. I know you're on holiday with the family, so it's much appreciated that you're able to share your experiences with us today. So thank you once again.